I am Dr. Richard Coleman, and I need you to listen to me very carefully because the next 10 minutes are going to challenge a habit you have likely maintained every single morning for the last 20 or 30 years. We are going to talk about the silence in your nervous system. I am not talking about a neurological disease or a genetic defect. I'm talking about the silence that has slowly crept into your bedroom, the dullness that has replaced the electric shock of pleasure you used to feel in your 20s. You think it is just age. You tell yourself that men naturally lose sensation as they get older, that the sharpness of touch is supposed to fade into a blunt, muted pressure. That is a lie. The reason you are struggling to feel, the reason you need intense friction to reach a climax, or worse, the reason your erection fades because your brain simply isn't receiving enough sensory input to keep the engine running, is not because of your birthday. It is because of your bathroom routine. You are systematically destroying the most sensitive instrument you possess, and you are doing it in the name of cleanliness. Let me take you into the typical morning of a man I treated recently. Let's call him David. David is 45, health-conscious, exercises 4 times a week and takes pride in his hygiene. Every morning, David steps into the shower. He turns the handle until the water is steaming hot, muscle-relaxing hot. He stands there, letting the scalding water run down his chest and groin, believing he is washing away the sweat and grime of the day. Then he grabs a bar of commercial antibacterial soap and a rough washcloth or a loofah. He lathers up and he scrubs. He scrubs the groin, he scrubs the shaft, and he scrubs the glans, the head of the penis. He scrubs until he feels squeaky clean. He dries off with a rough towel, gets dressed, and goes to work. David came to my office because he thought he was broken. He told me, "Doctor, I can touch it, I can feel pressure, but I don't feel it. The magic is gone. It feels like I'm wearing a condom even when I'm not." David didn't know that every morning, for 2 decades, he had been chemically and thermally castrating his nerve endings. He was stripping away the most protective, conductive layer of his anatomy, leaving him sterilely clean but utterly sensationless. To understand why this happens, you have to understand what you are actually washing. Most men operate under the dangerous misconception that the skin on the rest of their body is identical to the tissue on their glans. This is biologically false. The glans penis is not skin in the traditional sense. It is a mucous membrane, or mucosa. Anatomically, it has more in common with the lining of your eyelid or the inside of your cheek than it does with the skin on your elbow or your back. Now, I want you to conduct a mental experiment. Imagine taking that bar of harsh, drying soap, lathering it onto a rough washcloth, and scrubbing your open eyeball or the inside of your mouth with hot water for 30 seconds. The idea alone makes you wince, doesn't it? It would be agonizing. It would cause immediate damage. Yet this is exactly what you're doing to your glans every day. Because the glans is external, we forget it is a mucosa. We treat it like old leather, and in response, the body does the only thing it knows how to do to survive. It builds a shield. This process is called keratinization. It is a defense mechanism. When a mucous membrane is subjected to constant trauma, and make no mistake, hot water and harsh detergents are trauma, the body reacts by producing excess keratin. Keratin is a protein that forms the outer layer of skin, hair, and nails. When you scrub and scald that delicate tissue, the body says, "This environment is hostile. We are under attack. We need armor." So the cells on the surface of the glans begin to harden. They dry out. They layer over one another, thickening, becoming opaque and rough. The nerve endings, the dorsal nerves that are designed to pick up the lightest feather touch of sensation, get buried under layers of microscopic callus. This is the leather glove effect. I explain it to my patients like this. Imagine trying to read Braille. With your bare fingertips, you can feel the tiny bumps, the texture, the information. Now imagine putting on a thick, dry leather work glove and trying to read that same braille. You might feel that something is there. You might feel the pressure of the page, but you cannot read the words. You cannot feel the nuance. That is what keratinization does to your sex life. You are thrusting, you are engaged, but the signal traveling from your penis to your brain is muffled. It's static. And because the brain isn't getting that high-definition signal of pleasure, it stops sending the command to maintain a rigid erection. You lose the erection not because you aren't aroused, but because your body has literally lost touch with what is happening. I see this in emails constantly. A man named Robert wrote to me last month, desperate. He said, "I thought I had low testosterone. I went on TRT, I took the pills, I did everything. My libido is through the roof. But when I get to the moment, I feel numbness. My wife thinks I'm not attracted to her anymore because it takes me forever to finish, or I just go soft." Robert was a chronic overwasher. He was using industrial-strength body wash meant for grease and grime on a mucous membrane. When I examined him, the glans was pale, dry and slightly desquamated, peeling. He had scrubbed away his sensitivity. However, we must address the dual nature of this problem. While your shower habits are destroying the sensors, the nerves, there is often a deeper, more systemic issue lurking beneath the surface that compounds this numbness. You have desensitized the surface, but the deeper problem lies in the plumbing itself. For those serious about fixing this, I have linked a guide below on the vascular pressure blueprint, how mature men are flushing out arterial plaque to restore full, rigid blood flow naturally. It is a critical component because even if we restore the nerves, they need a blood-gorged environment to fire correctly. Now, we need to dissect the 3 specific enemies in your shower. You need to identify these so you can eliminate them starting tomorrow morning. Sin number 1 is the heat. I know you love a hot shower. It feels good on a sore back. But for your testicles and your glands, it is devastating. High temperatures cause inflammation. When you expose the dorsal nerve branches to scalding water, you trigger an inflammatory response that leads to desensitization. Furthermore, the heat strips away the natural lipid barrier faster than cold or lukewarm water ever could. You are essentially boiling the moisture out of the tissue. Sin number 2 is the chemical assault. Look at the bottle of body wash currently sitting in your shower. Turn it around and read the ingredients. I guarantee you will find Sodium Lauryl Sulfate, or SLS. This is a surfactant. It is a foaming agent. It is the same chemical used in engine degreasers and floor cleaners. Its job is to bind to oil and strip it away so water can wash it off. But the glans relies on natural oils, sebum, and if you are uncircumcised, smegma, to keep the mucosa moist, pliable and conductive. When you use SLS on this tissue, you are dissolving the very medium that allows nerve impulses to travel efficiently. You are drying out the land until it cracks. Without that lipid barrier, the nerves are exposed to the air, causing them to retreat and become dormant. Sin number 3 is the mechanical trauma, otherwise known as the loofah, the sponge, or the washcloth. This is the habit that is hardest to break. We associate scrubbing with cleaning, but on a microscopic level, a loofah is a cheese grater. When you scrub a mucous membrane, you are creating micro-abrasions, tiny tears in the tissue. You cannot see them with the naked eye, but your immune system sees them. It rushes to repair the damage. How does the body repair a tear? With scar tissue. Scar tissue has 0 nerve endings. It is inert. Every time you scrub, you are replacing highly sensitive, electrically active tissue with dead, unfeeling patchwork. You are literally erasing your ability to feel pleasure, stroke by stroke. I had a patient, Jonathan, who didn't believe me at first. He was convinced that if he didn't scrub with soap, he would be dirty or smell. This is the fear that marketing has instilled in men. I told Jonathan, your eyes clean themselves with tears, your mouth cleans itself with saliva, your glans is designed to be self-regulating with water. I challenged him to a 30-day protocol. No soap on the glans, no scrubbing, lukewarm water only. He came back 3 weeks later, not 30 days, 3 weeks. He sat in that chair and looked at me with genuine shock. He said, "Doctor, I woke up with morning wood that hurt, in a good way. I could feel the fabric of my underwear against me. I haven't felt that since I was 22. The color had returned. The texture had changed from dry parchment to smooth, healthy mucosa. The keratin shell was shedding. This transformation is possible for you, but you have to understand that sensitivity is only one half of the equation. As I mentioned with the vascular system, you can have the most sensitive nerves in the world, but if the blood vessels are clogged with years of plaque buildup, the erection will not hold. Restoring your sensitivity is step one. But remember, a sensitive nerve is useless if the blood cannot rush in to support it. Make sure you check the first link below for the vascular pressure blueprint, how mature men are flushing out arterial plaque to restore full, rigid blood flow naturally. You need to attack this from both the nerve angle and the blood angle. So, what is the protocol of recovery? What do you do tomorrow morning when you step into that shower? First, temperature control. You can wash your body with hot water if you wish, but when it comes to the groin, you turn that dial down. Lukewarm water. If it doesn't feel cool, it's too hot. You are mimicking the body's internal temperature, not cooking it. Second, the soap ban. Take your body wash, your bar soap, your scented gels, and keep them away from the glands. Use them on your armpits, your feet, your back. But for the penis, you use water. If you absolutely must use a cleanser because of a specific medical condition or intense sweating, you use a pH-balanced, soap-free cleanser specifically designed for intimate areas or sensitive facial skin. But for 99% of you, warm water is enough. The clean smell you are chasing is actually the smell of chemical perfumes masking the natural scent of a healthy body. A healthy glans does not smell bad. It smells like skin. If it smells bad, it is usually because of trapped bacteria from not rinsing properly or fungal issues caused by, you guessed it, destroying the natural bacterial flora with harsh soap. Third, throw away the abrasive tools. Your hands are the only tools allowed. Gently rinse the area. Retract the foreskin if you have one. Rinse with water, and that is it. No scrubbing. Fourth, and this is crucial, the drying phase. Do not take your towel and saw it back and forth across your groin like you are polishing a shoe. Pat dry, gently. Dab the moisture away. We are preserving the integrity of the cells. If you follow this protocol, here is what will happen. In the first week, you might feel strange, perhaps a bit oily, as your body readjusts its oil production because it's no longer being stripped daily. By week 2, the thick keratinized layer will begin to slough off. You won't see it peeling like a sunburn, but the dead cells will wash away, revealing the fresh, new cells underneath. By week 3 and 4, the nerves that have been dormant, buried under that leather shield, will wake up. You will notice sensations you had forgotten. The texture of sheets, the temperature of the air, the touch of a partner. It will all feel amplified. The static will clear and the high-definition signal will return. This is not magic. This is physiology. You have spent years hardening yourself against the world, quite literally. It is time to soften. It is time to allow your body to function the way it was designed to, before marketing campaigns told you that your natural state was dirty and needed to be sterilized. I want you to try this. Not for me, but for yourself. Commit to 30 days of the benign neglect method, leaving it alone, treating it with gentleness. Witness the change in your sensitivity, and by extension, your confidence and your capability. And as you embark on this journey of reclaiming your physiology, do not ignore the engine that drives it all. The blood flow, The vascular health is the foundation upon which this sensitivity dances. If you found this information vital, if you want to understand the full scope of men's health that the mainstream ignores, I invite you to subscribe to this channel. We are building a community of men who are taking ownership of their biology, refusing to accept getting old as an excuse for dysfunction. Join us. Click that subscribe button, check the guide below for the vascular blueprint, and start treating your body with the respect and the science it deserves. I'll see you in the next video.